on Facebook, LinkedIn, or YouTube, leaving in the comment section. I will turn the floor to Mike and Maria. As we've heard some encouraging news a few days ago from our Director General that globally number of cases is declining for 5 weeks in a row. So they will walk us through the epidemiological picture at the moment and to tell us where the cases are going down and what's happening. Good afternoon, Mike, Maria. Thank you for finding the time to be with us in your busy schedules. It's much appreciated for answering the questions of our social media followers.
Good.
Hey, Alex.
Hi, Maria. Would you like to start with where are we with cases?
Yes, sorry. And sorry for the technical difficulties for all of us on our side here and making you guys wait. Yes, I mean, the global situation remains mixed. As we've been saying over the last many times we've done these Facebook lives, these social media lives, we have seen some good trends. In the last 5 weeks, we've seen a decline in case incidents and case numbers, and we're also starting to see a decline in deaths. In the last week, I'm looking at my cheat sheet over here in our weekly epidemiologic report that was published yesterday. You can see in that, and that's on our website, that there's been a 16% global reduction in case numbers in the last 7 days. And we've really seen a decline in almost all regions of WHO regions, with the exception of the Eastern Mediterranean region, which saw a slight increase. But we've seen a decline in the percentage of deaths in the last week as well. There's been a 10% decline in deaths. But if you look at the global picture, it's really dominated by a handful of countries that are showing a rapid decline in cases. But the picture at the regional level is mixed. And of course, within some countries, not all countries are seeing the same rates of decline. So these are good trends that we're seeing, but it's really important that we don't become complacent, that we still work really hard to make sure that we are driving case numbers down as low as we can. The other encouraging sign is that even in countries that have seen some of these virus variants that have been detected in the United Kingdom, in South Africa, and also in Brazil, these variants are circulating in other countries. We're also seeing a decline in countries where the variants are circulating. And this means that this virus, including the virus variants, can be controlled with public health and social measures, with the measures that you and I and our families take every single day. And that's really good news, but we really need to make sure we stay focused and we continue to drive those numbers down.
Thank you, Maria. Mike, what is your reflection and what do we need to continue doing to see the number of cases going down?
Well, it's great. First of all, it's great to see the declining trend. As I said before, when epidemics trend down, it's never all our doing. I mean, there are some natural patterns to disease transmission and spread, some seasonality and other issues, but certainly ordinary people deserve huge credit for what they're doing to reduce the chance of this disease transmitting from person to person. And that's working. And that's working even in the face of the emergence of variants with some increased transmission capacity. So it shows that the measures we currently have in our hands are working. The current declines are not a result of vaccination yet. They're really more the work that every individual around the world is doing to try and reduce their own risk and reduce the risk of to others. So take a bow world. You're doing this. The virus may be helping a little in terms of its own seasonality. We're getting better at doing that. But we've also had these, very serious lockdowns, the stay-at-home orders, and everything else. We're paying a heavy price for getting this level of control. The question now is whether we can come out of these heavy measures into a more sustainable way of controlling the transmission of this virus. A new way of doing business that's a little bit more agile, getting our kids back to school, getting our social sort of enterprises back, our social services, our mental health services, and other really important things, while maybe still foregoing some of the things we want to be doing. And that's going to be the next, I think, phase. The other thing I think is vaccines are a real addition over the coming months. We hope this will happen all over the world. that vaccines will start to reduce deaths and hospitalizations in vulnerable individuals and in our healthcare workers. And once we stop the deaths and the images of ventilation and overcrowded ICUs, and people not being able to access oxygen when they need it, if we can get through that by using vaccination to prevent the worst infections, then we'll have more choices around what we want to do next in terms of opening up our societies. But we need to sustain all we're doing now and add vaccination, not use vaccination as an excuse to abandon everything else, because that will not go well. That will not go well at all. So how do we sustain our effort? Open those parts of our life, like education, that are so badly needed, and then use vaccination in a very strategic way to reduce the death and suffering all over the world.
Thank you very much, Mike. Maria, maybe you wanna go again and reminding our viewers on what are those measures that are actually bringing those results. Mike was now reflecting that vaccines, we're not seeing these results thanks to vaccines yet, but maybe we can remind people of this package of tools that we've been talking for a year now, and that are showing good results at the moment and throughout the last year.
Yeah, thanks, Alex. It's a combination of factors that each of us do every single day. One of the main things that we can do and we can continue to do is keep our physical distancing. And I think you know, and many know, that WHO doesn't say, we don't say social distancing, we say physical distancing, because it's about keeping physically distant from people while remaining socially connected. It's about good hand hygiene. It's about keeping your hands clean throughout your day. It's about wearing a mask and making sure that you're wearing a mask appropriately, making sure you cover your nose and your mouth with clean hands, making sure that if you adjust your mask, you clean your hands. When you take off your mask, you clean your hands, and you dispose of that mask if it's single use properly, or if you can wash it, you wash it appropriately. Making sure that you practice respiratory etiquette and sneezing into your elbow, making sure you open a window and a door in a room, making sure you improve the natural ventilation in rooms. It's about avoiding crowds. I mean, one of the big things that I think is driving transmission down right now is that after this holiday period that we've all gone through in November and December of 2020 and into the new year, there was a lot of social mixing. And if you think about what you do every day and how many people do you come in contact with every day, and what are the settings and the situations in which you come in contact with others, how are the different ways that you could reduce the number of people that you come in contact with? And if you do need to come in contact with others, how can you do that in a safer way? By wearing a mask, by keeping your distance, by opening the windows, by practicing respiratory etiquette, by avoiding peak times for grocery shopping, for example, by using online shopping if you can. All of these different measures, different ways in which you can understand the risk that you may have in terms of the risk of exposure, and all of those measures that you can take to reduce your risk matter. And this is what is driving transmission down right now. People are mixing less. We are seeing less travel. We are not seeing families come together like many did over the holiday periods. And this is what is working to prevent the virus from spreading from me to you, to prevent my family from infecting your family, for example. And all of these measures we need to continue to adhere to as vaccine and vaccinations roll out. Vaccination will be another incredibly powerful tool that we will have in our toolkit, that we now have in our toolkit, but it is not widely available. And right now we need to make sure that vaccines and vaccinations reach those who are most at risk, who are health workers and who are people of advanced age. Those are the individuals who need priority for the vaccination all over the world, not just in a few countries. So lots that we can do, Alex. You've heard both Mike and me and the DG say this a lot. We will continue to say it because we need to remind everybody that we have some power in what we do every single day. So know your risk and use that information and the tools that you have to lower your risk every day.
Thank you, Maria. And even though we see this encouraging news, it's still not the time to get relaxed and to stop practicing those measures. But it's been over a year and people are getting tired. So what is your advice? How you motivate yourself and you try to motivate people around to keep up with all these measures, keeping the distance, wearing masks, cleaning hands every day again and again. And even when you feel low and you want to see your friend or a family and you want to give a hug, but you don't do it. So how we can boost our motivation every day to keep up?
Mike, you want to start?
It's tough. I was actually just reflecting on what you were saying, Alex, and just how tough it is reminding yourself to do the right things, and maintain that physical distance and wear the mask and wash hands and do all those things that we're expected to do. And yes, the mechanical things are reasonably easy to just continue to do. I think the hard part is the separation from family and not having those close personal relationships. I've seen my kids 3 times in 14 months, and it's I miss them more than they miss me. But it's about minimizing the risk, and and it's tough. It's not easy. Everyone, we're paying a high price for this, but the price of doing nothing is higher, and that's the problem. And in life, that is sometimes what we face. Sometimes we just have to continue to do things, and to try and sustain that in as best we can. I think there is light at the end of the tunnel. I think the prospects of opening up a little more are coming as we need to control the death and the hospitalizations. We need to stop that being a reality of our lives. And I think once we can get that stopped, then we can sustain our behaviors a little. I think we can begin to control transmission a little better. We will have more vaccines. We will get second and third generation vaccines. I believe we will have develop even better treatments. And when we have better treatments and we have better vaccines and we have better access to vaccines, then we'll have much greater choices about how we have to live in future. And I think the thing that's really hurting us all right now is that inability to gather socially, be it in your home, be it in your garden, be it in a restaurant. That's really affecting people's lives in a very deep way. And it doesn't matter which country you're in. It's not being able to engage with each other in the way we expect. We are social animals. We are entirely social animals. So it is tough. There's no easy answers. I'd like to just say to you that there is no other way right now than us sustaining those behaviors, committing ourselves to continuing to do that, to protect ourselves and others, and then hoping that we can get enough vaccine out to enough people so we can stop the death and suffering.
Thank you, Mike. Maria, how do you motivate yourself and people around you to keep up with the measures?
Well, I think the key word that you have there is motivation. What is it that motivates you? And whatever that is, hold that close. For me, what motivates me is, thinking of my friends and family and my husband and my children and the life I want them to have. The idea, the notion that any of us and many people are watching have had a direct family member, an immediate family member infected with COVID-19. And maybe they had a mild disease and they recovered just fine. Maybe they're suffering from long COVID and they don't know the prospects of the future. Many have lost jobs. Many have had family members who died. And the motivation of thinking of who I love most in this world and who I hold dear most in this world, to protect them from that pain, is motivation to me. And what we do at WHO is we're all people. We all have families and friends. And what we are trying to do is we are trying to support countries and decision makers in countries, individuals, families, communities, and different levels of leaders in all aspects of society to do the right thing, to model the right behaviors. And I think it helps me to see collectively people adhering to advice, so that it doesn't become so different. It doesn't seem different if somebody is wearing a mask here and others aren't. I mean, I think we can inspire each other to, do the right thing to keep ourselves and our loved ones safe. But my motivation is my family. My motivation is the people that we work with. I see, I mean, Alex and Mike, we have amazing people that we work with in so many different aspects of our jobs, not even just COVID-19. Now we have many other emergencies that we are dealing with, and people get up every day and work very, very hard to make sure that we are giving the best advice, that we are collaborating around the world, that we are trying to bring in as much knowledge and turn that knowledge into know-how. And as Mike always says, turn that know-how into how-to and adapt it to the local. And that's what motivates me, because we could always be doing more. And I think that's what kind of drives all of us. On the flip side of that, the frustration I have is to see people not not see this as the serious disease that it is, to see this as a serious virus. And if we can come together, if we can collectively, hold the line and hold on to what works, we will get through this sooner. By not doing so, we're actually delaying the end of this. So there's a lot that we need to do collectively. And the more we can act as one in this, the quicker we will end this. And that will also help with climate change. It will help with so many other things that are affecting ourselves and our planet.
Thank you, Maria. Here is the question from our viewer on LinkedIn. What do you consider will be the next steps and the most sustainable measures for our daily life?
I think it's very much a follow-on from the previous question, Alex. I mean, if we look at the next steps now, if we look at globally in terms of our strategic approach, clearly getting vaccine rolling out to every country. So all those vulnerable and most at risk of hospitalization and death are vaccinated, and the frontline health workers are vaccinated. That is an absolute priority for us. And that's not a guarantee right now in terms of equity and access. In terms of what we need to do as an organization with our partners, we need to continue supporting countries to make sure that those people who do get sick get proper clinical care in safe facilities with access to medical oxygen, access to dexamethasone, and the best possible care. And we need to continue focusing on that. That won't go away for a good while. We need to focus on how we save the lives of the people who do get sick. We need to continue to focus on surveillance and contact tracing and quarantine. And you'll see many countries doing a very good job. You look at New Zealand, Australia, and others, they've had low numbers, but you see every time they get a case or a cluster, they're all over it. They jump all over it. They are determined not to let this virus reestablish itself. And there are many countries like that, particularly in South Asia and in the Western Pacific, who are really have got control on this virus without a vaccine. And they are knocking the ball out of the park when it comes to, picking up those clusters and sporadic cases and really dealing with them very effectively. It might not work every time, but they're really having a go. And they've taken a very, very high degree of control. Other countries need to get into that situation. It's not easy when you're coming off a very high peak to get down low enough where you can be fully in control of what's happening and contain the spread of the virus and stop the clusters turning into community transmission again. Avoiding widespread community transmission, moving away from that to a more sporadic or cluster-based transmission, so we can then we can get our kids back in school, we can begin to ease the measures that are so disrupting our lives is also a big priority. So I think for me, we need to focus on vaccine distribution, we need to focus on continuing to strengthen our health services, and we need to focus on on getting the numbers as low as we can and then keeping them low with good public health services in terms of surveillance, contact tracing, quarantine, and then continuing to do what we, as individuals, all of us need to do to reduce our risk of transmission. I think if we can achieve all of that, then I think we can avoid going into these punishing lockdowns going forward. But we need to do all of that. And we need to do it all, and we just need to continue. If our goal is to get back to anything that looks reasonably like normal life.
Thank you, Mike. Here is the next question from viewer Aspasia Michalopolo, who is watching us on Facebook. Scientists are working on vaccines, and what is happening on therapeuticals. Maybe you can reflect on the work that's been done on treatment for COVID, and have we made enough efforts to find a cure for COVID, as vaccines have been getting a lot of attention, rightly so. But what's happening on the other side of science and other tools that we could have to treat patients?
You want to start that one, Maria?
Yeah, I can start. There's quite a lot that's happening on the therapeutic side. You know, we have an amazing clinical management team led by Dr. Janet Diaz, who has an amazing team herself looking at different treatment options. And in fact, treatments for coronaviruses began, following SARS coronavirus in 2003, following MERS coronavirus starting in 2012, and that there were clinical trials underway. In fact, when the cluster of pneumonia of unknown etiology in Wuhan was reported at the end of 2019. And we were able to bring together clinicians who are working with MERS patients, who are in Saudi Arabia, for example, working with patients treating coronavirus patients, now known as COVID-19, in China, to bring them together to say, okay, what treatments are you looking at? And some of this is repurposed drugs, antivirals that are out there. Some of these are looking at monoclonal antibodies and looking at lots of different options. There are many clinical trials that are underway all over the world. There are thousands of them underway. And the challenge with having thousands of clinical trials underway is that many of them are really small. They only have a small number of patients. And so if they're evaluating treatment A, and they have a small number of patients, and another clinical trial has another small number of patients, and they're looking at treatment B, we don't get the answer to, does this work? Is it safe and effective fast enough? And so we initiated the Solidarity trial, as you know, which is bringing together hundreds of hospitals around so many countries around the world to try to recruit patients to get to better, quicker answers with a number of different therapeutics. The short answer is we need to do much more in terms of looking at therapeutics, looking at early treatments so that we can prevent someone who is infected from developing disease, somebody who is mild from advancing to more moderate or severe disease, and then looking at treatments for people who are severe and preventing them from dying. So there are lots of different elements of treatment that we are looking at. Right now, we know that dexamethasone, which is the corticosteroid, which is widely available around the world. It's inexpensive. If this is administered to critical and severe patients, can save lives. And that's amazing. So we need to make sure that is administered to patients. But there are many more treatments that are under study right now. And for us to make advice and to give guidance on treatments, we need to be able to bring data together from different studies all over the world to make an assessment. Is this a safe and effective drug? And if so, then we issue guidance. And that takes a little bit of time, but there are many that are underway. And I'm hopeful that we will have more treatments, even looking at the more mild end of the spectrum, all the way through severe disease coming online, hopefully soon. I'm sure Mike will want to add to that as the medical doctor in this group.
Mike, you have the floor.
No, very good, Anna Maria. Maria, I think the issue is there, and Maria said it quite clearly. There is no cure as such for this virus, and that's a problem. Vaccines can prevent the worst aspects of the infection, so in that sense, they represent a type of cure. We don't have specific therapies. What we do have is the capacity to support what is our best weapon against this virus once it gets into our body, which is our immune system and our basic level of health and our ability to get through the infection. So patients need a lot of support. Some don't need much. Some patients need oxygen support, high flow oxygen. It's life-saving. A lot of people around this world right now do not have access to that basic measure. And you've seen the TV footage of people desperately running up and down streets trying to buy oxygen canisters to run to a hospital. to deliver it in time to save a loved one. Oxygen is not a cure, but it can give person a chance at life during that critical 24 to 72-hour period when people are struggling to breathe. We can get people through the intensive phase by giving good intensive care. We see that case fatality rates drop when the number of patients needed to be treated drops. The doctors and nurses are not as exhausted. They have more time with each patient. So the more we drop the number of people arriving in the healthcare system, the less pressure the health system is under, and the more time and expertise each doctor and nurse can put in, each physiotherapist, everyone can put more time into that individual patient. That's a way of helping to get people through the worst. Maria mentioned dexamethasone and other corticosteroids. What they're doing is effectively suppressing the worst aspects of our own immune response. Our body reacts to the presence of the virus, and in those first days, you feel terrible. You might have a fever. The virus is in your system. You may have chills, and your body is beginning to mount an immune response. And for the most part, we do. We feel awful for a few days, and then we break that fever and we start to recover. For a proportion of people, they do that, and they begin to clear the virus, but their immune system sort of goes a bit into overdrive. It overshoots the runway, and it starts to really react, and that's what causes a lot of the inflammation in the lungs, which reduces the capacity of oxygen to pass between the air and into the blood. And it's in that critical period where you hear this word desaturation, where normally your blood oxygen should be between 92 and 98%, and then people's blood oxygen drops, and it can drop catastrophically and quickly. And it's during that period that things like the dexamethasone and other drugs can actually reduce the inflammation enough so the oxygen can cross into the blood. That's what giving high flow oxygen does. It just puts more of the concentration of oxygen you're breathing in goes up, which means more oxygen gets into your blood. That's what ventilation does. It takes over the role of your lung, of your chest to get as much air and oxygen into your lungs as possible. It's really important we give that support at those critical phases. But if you're in a hospital where the ICU beds are full and the doctors and nurses are exhausted, that's not an option for you. So that's another way in which we can, in that sense, not cure the virus or cure the disease, but support the patient through the disease. And that's just as important. We don't have broad spectrum antivirals that we can use that work against multiple diseases. We've seen lots of attempts and lots of good drugs come online. We're seeing now the potential use of monoclonal or polyclonal antibodies. These are basically antibodies that are recovered from the blood of recovered patients, and then they're engineered and produced in bulk and concentrate, and we can use them as cocktails. So they basically give the person effectively a boost to their own immune system to clear the virus. In general, they have to be given relatively early in the disease, and that's the trick, is actually deciding who's going to need them, because they're expensive, precious, and not widely available. A lot of work is going on. I know the Gates Foundation and Wellcome and many others are really investing in a lot of discovery projects to look at specific small molecules that might have an antiviral activity against COVID. And there's a lot of, Maria said, small scale trials going on, looking at all of those different potential cures. And it would be fantastic if one or more of those processes results in us getting an effective drug that can treat the disease specifically. So I do have hopes for the polyclonal and monoclonal antibodies. Certainly, we will develop better ways of managing. We've also got, I think, IL-6 inhibitors and others that are helping with modulating the immune response. So we either need to find drugs that can effectively kill the virus, or we need to find drugs that can dampen the negative impacts the virus has on the body, and help the patient recover. Probably not as much progress as we need to be making in this area, for sure. And we continue to work with our partners in the therapeutics pillar of the ACT Accelerator, work very, very closely with our colleagues in Gates and Wellcome, in United and others, to do that necessary discovery and research and innovation process. But this is still a story to be told. But just to remind everyone, we have some excellent tools. It's making sure that the patients have access to those tools, and that the doctors and nurses are able to give the time and have the space and are not so exhausted that they can deliver the proper levels of medical care required. Back to you.
Thank you, Mike. And I'm glad you mentioned as well the importance of health workers not being exhausted, so that they can pay attention to every patient and support them in the best possible way. Because one of our viewers is asking if WHO is working on a plan for a comprehensive guidelines to deal with first responders burnout and rotation.
That is a great question. In fact, we are working on that, because it's not just about giving health workers, guidance on how to care for patients, making sure that they have the right PPE. It's all about the work environment that they are in, and making sure that they are supported in the workplace as well as outside of the workplace. I think we've seen too many health workers be stigmatized for the work that they do, and in some situations, treated very badly for the work that they do in terms of caring for COVID-19 patients. And on the other hand, we've seen in some countries, health workers, celebrated, and in most countries, health workers celebrated for the work that they do. But it is important that they have a safe working environment, that they have opportunities to make sure that they have training, that they have rest periods, that they have adequate PPE. I think, in the beginning of this pandemic, we were really struggling with personal protective equipment, making sure that we had enough personal protective equipment, gowns, gloves, goggles, etc. And we worked very hard with our partners to increase production capacities for essential personal protective equipment, and working with many partners to ship this around the world, to get into the hands and in use, proper use by health workers around the world. That has improved dramatically over the last year, but it's still not fixed. Like, we still need to make sure that we work hard to ensure that our health workers are protected and that they have that safe work environment. So yes, we are working on that to make sure that the occupational health and safety of health workers is assured, in addition to the trainings. And that is something that we are constantly looking at. We work with a lot of different medical associations and nurse associations to discuss directly, what are the risks that health workers face? What are the challenges that health workers face? What is it that WHO and partners can do to support health workers carrying out the life-saving work that they do, not only for COVID-19, but for all other diseases that need to be attended to, because we need to make sure that essential medical services are up and running. Babies still are born. People still need cancer treatments and other surgeries and vaccinations for COVID, but also for vaccine preventable diseases. And so there's a lot of work that we need to do to continue to support our health workers around the world.
Thank you, Maria. Mike, would you like to add something?
No, I think it's a real issue for our frontline workers, but it's also an issue for so many workers working in the front line. And there are many front lines in this response, be it workers working, keeping our food supplies going. I think of seafarers some of them have spent a year at sea without getting home. They've kept their supply chains going all around the world. Some of them haven't seen their families in over a year. Some of them haven't even been on dry land in a year. There are others, essential workers, and the people who run the ambulance service. So many others are police services and others who continue to do tremendous work. And everyone is tired in this, and it's difficult. It's difficult for teachers to manage the online environment, and I'm sure they're stressed by the worry of their kids not attaining the levels of educational advancement that they need. So everyone is stressed and burnt out in different ways in this response. But frontline health workers have had to deal with this. Certainly those dealing in the COVID wards, it's been relentless in many situations and tough. And there's nothing more heartbreaking than them feeling helpless in that situation, and particularly experiencing the loss of people who have not had contact with their families. That is brutal. I've worked on the inside of Ebola wards, and it's the most heartbreaking thing in the world. And working in that gear and doing the hours and just existing. I think it becomes an existence for a lot of health workers, just surviving each day. and getting up each day and going again. And they are heroes. They really are. They're amazing, amazing, amazing people. They're the best of us. Um, and they need our support and encouragement, but they need the resources to do the work. They're willing to do the work. They just need to have the extra support, have the extra workforce, have the PPE, have the drugs, have the things they need. And they need us to do what they've been asking us to do, which is prevent the disease spreading any further, because that's the best gift we can give them, is to reduce their workload by taking care ourselves, taking care of others. Because if we can reduce the number of cases, that's when the pressure drops on them, and that's when they can do a better job, and that's when the stress levels will drop for them. So but mental burnout is a real thing. We deal with it all the time with our teams in Geneva. We've lost friends on the front line to infectious diseases. We've had friends killed in incidents. Healthcare systems are being increasingly attacked around the world, not just from COVID, but we've seen attacks on healthcare facilities, not as accidents, but as perpetration of terrorist or warlike acts. And it's just, it's not acceptable. Health workers are under more pressure now than they have ever been in the past. Underfunded, under-resourced healthcare everywhere, north and south. Healthcare workers have borne the brunt of that, and let me remind you that 80% of healthcare workers around the world are women. They are the ones who drive and deliver our health service. And yet, when we design PPE, we tend to design it for men. So what way around is the world? We have a health service delivered by women, but designed for men. So there are lots of things we need to fix, and there are lots of stressors on our healthcare workers. It's not just COVID. COVID is almost like a last straw for many of those frontline workers working in underfunded and under-resourced services. Some of them have broken with that, and I've come back from the field on different occasions, and it's a dark night of the soul to have to deal with the levels of exhaustion and regret, and dealing with the sorrow and dealing with the tragedy of what they're witnessing is something they're going to need help to recover from. They're going to need psychosocial and other supports to process what they've been through and what they've witnessed. But they will continue to serve because they are who they are. As I said, they're the best of us.
Thank you, Mike. Thank you, Maria. And before we close, maybe we can also remind everyone that they can join us in our call for vaccine equity, and to call on governments and countries and everyone to ensure that health workers are the ones who are vaccinated first, so that we can protect them, so that they can do their work safely, and also to help us if we get sick, not just from COVID-19, but from other diseases. We or our family members or friends would need their support. Before we close, maybe I would just give the floor to you for any final words. And I thank everyone for watching us today.
I think, Alex, people a lot of the time they say, what can I do? What are the things that I can do right now that can help? I can hear my parents in the background saying, okay, what do we do? How do I help? I can hear my sister, who I have to say happy birthday to, who has her birthday in a few days. There are 4 things that everyone can do in my view right now for health workers and for frontline workers. The first is to keep yourself safe. If you could prevent yourself from you getting infected, and if you are infected, take the necessary measures to isolate, to contact, make a list of all of your contacts so that contact tracing can be carried out. So the virus, if you are infected, ends with you. It doesn't get passed on to somebody else. That is the single most thing you can really do to not only drive down transmission, but it does, as Mike said, reduces the burden on the health system. The second thing you can do is help someone out. Health workers, teachers, many frontline workers are working ridiculous hours. They're tired, they are exhausted. One of the most touching things I saw when I was in China in February last year, a year ago, were neighbors helping health workers of dropping off groceries outside of their door. Or at the time, there were neighbors that were going into a health worker's home and cleaning up their house or watching their child. Pick up the phone and give a call and say, you're doing a good job. I've got my son's rainbow behind me of good job. You're doing a good job. That support, that verbal, that physical, that support is needed. The third thing you could do is promote vaccine equity and donate and to different places that will collect money or that for health workers or for people in need or for vaccination. And the fourth thing that people can do is innovate. I think that we are seeing a lot of really cool innovation related to PPE. As Mike said, PPE is designed for men. It's not designed for women's bodies. It's not our faces and our bodies. And a lot of it is really uncomfortable. And if you have to wear it for long periods of time, or you have to wear it for extended periods of time because we don't have enough to use more. We've seen some really interesting innovations for, face shields and different types of masks that can keep health workers safe and can keep essential workers working. So there's a lot that we can do in different aspects of this pandemic. So don't sit back and think, oh, poor them. Think about, how can I get engaged? What can I do? How can I rally the support for health workers around the world and take some action?
Thank you, Maria. Thank you very much. This was very, very good closure. Mike, would you like to add something before we close for today?
As usual, what she said. I think I can't do better. I can't do better than Maria. The future is in our hands. We have to take the heat out of this pandemic. We have to reduce the death and suffering that's been associated with it. We have the tools to do that. We can get back to something that looks like a normal existence for us all. If we focus on doing what we can at individual level, at community level, if governments continue to support their communities, continue to support vaccine equity, then we can do this. But we all need to come out of this together. This is a real moment for the world. We cannot leave anyone behind. If we're going to address the bigger threats of the future, like climate change and social justice, and we're going to deal with the threat of pandemics, these are all potential threats, but they're also on the other side of that, a fairer world. I want to see a healthy planet, healthy animals, healthy people in a fairer world. And we're being tested now. Are we prepared to take the first steps towards that better world together by doing what we need to do individually, at communities, at government, at international level? And I think we're making some of that journey. We're making some good choices. We're making progress, but we're not there yet. We're making progress. And we need to stay that course. I know how tough that is to say. It scares me to say it to myself, because I can tell you we're tired too. But we get up every day and we move on. I keep quoting Nelson Mandela, I think what he said, that's do not judge me by the number of times I fall down, but by the number of times I get back up again. And I think that's what we have to do. We just need to keep getting back up and keep pushing and stay the course.
Thank you, Mike. Thank you, Maria. Thank you for your time today. I thank all our viewers for watching us, for asking their questions, for following our advice, for staying the course and keeping up with all the measures we need to do to stop this virus, to save lives, and to protect health workers and our loved ones from getting sick. Thank you, everyone, and until next week, stay safe.